Go ahead, Claire.
Thanks, Elizabeth. And good afternoon, good morning, everybody. Thanks so much for coming back or joining us in this series of CNA, Canadian Nurses Association webinars that we've called Coffee with Claire, and I do have my, my coffee with me. For those of you who are new this week, my name is Claire Becker, and I'm the president of the Canadian Nurses Association. And I'm a long-standing registered nurse here in Winnipeg, Manitoba, and I'm coming to you from my home, where I have the privilege of working from home and still working as the scientific director of the National Collaborating Center for Determinants of Health here from my home. And I want to say again, it's a distinct privilege to be able to do that from my home here in Winnipeg, Manitoba. And it's a beautiful sunny day here in Manitoba. We launched this webinar series a couple of weeks ago to give the Canadian Nurses Association an opportunity to engage with our members, with you, on issues that are important to you related to the COVID-19 pandemic, our response, and into the future in terms of recovery. This week's conversation will focus on the emotional and psychological toll of the COVID-19 pandemic, both current and also what we anticipate into the future. And I'd like to sort of frame this as we're considering this from both a personal as well as a professional perspective. So I want to start by thanking all of you for all you're doing every day, for the knowledge, for the skill, for the science, for the leadership, and for the care that you are providing across the vast health system from coast to coast to coast. The nurses, licensed practical nurses, registered practical nurses, registered psychiatric nurses, nurse practitioners, and registered nurses. So thank you from me, but also thank you from our board of the Canadian Nurses Association, our staff, and our officers. And within the organizations that are there to support you and to advocate on behalf of nurses, nursing, and health of all. So thank you to those who are working at the front lines, at the point of care, but also within organizations that are there to support you. But we're all also members of families, of communities, and of other organizations. So the issue of mental health and well-being extends beyond our professional roles and really into our personal roles as well. So I'm very, very happy today to be joined by three nurses who are experts in the field of mental health. And I just want to ask them to give a wave as I introduce them. So first of all, we have Florence Budden, who's a nursing instructor at the Center for Nursing Studies in St. John's, Newfoundland. And she's a registered nurse. She's also a past president of the Canadian Federation of Mental Health Nurses. She's the co-chair of the Canadian Alliance on Mental Illness and Mental Health. And she's a proud CNA, Canadian Nurses Association, certified nurse in psychiatric and mental health nursing. Florence has over 25 years of community involvement and advocacy work with individuals and families affected by mental illness. So thanks, Florence, for joining us here today. Secondly, I'd like to welcome Candace Waddell. Hi, Candace. There's Candace. She's a registered psychiatric nurse from Brandon, Manitoba, so in sunny Manitoba here with me. She's an assistant professor in the Department of Psychiatric Nursing at the Brandon University, and a member of the board of directors of the Canadian Federation of Mental Health Nurses. Candace has worked nationally and internationally on projects and collaborations that have focused on improving Indigenous mental health and wellness, and also reducing the impact of trauma. So we're really looking forward, Candace, to your perspectives on that. And finally, Louise Bradley, there she is in just outside of St. John's, Newfoundland, normally in Ottawa, Ontario, but Louise Bradley is a registered nurse, but she's also the president and chief executive officer at the Mental Health Commission of Canada. And the Mental Health Commission of Canada is doing some extraordinary work, Louise, and we thank you and your team for that. Louise is a long-standing registered nurse who's been charting a new course to improve the lives of Canadians living with mental illness since the very early days of her career. And so, Louise, we really look forward to your perspective in our panel and in our conversation here today. So on behalf of everyone from the Canadian Nurses Association, I want to thank all three of you for taking time out of your busy schedules to join us for this conversation today. So the process will be about 45 minutes conversation. I'm going to start by very briefly updating you on what the Canadian Nurses Association is doing in this area. Then I'm going to ask our three experts a question. And that question is based on feedback that we heard from you in previous conversations, and also what we're hearing in our polling and in our conversations with nurses. Following that, there'll be an opportunity for you in the audience to ask your questions. We had over 300 people register for this session, so there's a lot of interest in this particular topic. And I'm going to say this won't be the only time that we talk about this issue. It's a big topic and one that I think we'll have some further conversations about. If we don't get to your question today, don't worry. The staff at the Canadian Nurses Association will be compiling those questions, and we have sort of a living Q&A on our website, frequently asked questions on our website. So I'd encourage you to go there. So in terms of logistics, you seem to have found our chat box, and I'd encourage each and every one of you to just give a shout out from where you are and who you are within that chat box. And it's at over to the side on your screen. But down at the bottom, there is if you hover your cursor down at the bottom, you'll see a Q&A button. And it's in that Q&A that we'd like to ask you to put your questions, and we will address as many questions as time allows. And certainly you're welcome to put your comments, your ideas, share resources in the chat box, as well as any other topics that you think might be important for us to address in these conversations. The discussion will be in English. However, we are joined by Josette Roussel, who is the Executive Advisor at the Canadian Nurses Association, who will be able to answer questions in French. And I'd like to turn it over just for a few minutes for Josette to speak in French to those of you who might want to have the conversation in that language. Josette?
Thank you, Claire. Bonjour à tous les participants de la session d'aujourd'hui, le café avec la présidente, une conversation sur la santé mentale. Alors, je vous invite à poser vos questions sur l'endroit Q&A sur votre écran en bas, et nous allons répondre à vos questions en français, et nous vous remercions de votre participation. Over to you, Claire.
Thanks, Josette. Just before we get going, I just wanted to take a moment. Tim drew my attention to the fact that Linda Silas, the Canadian Federation of Nurses Unions, called for on Facebook a moment of silence about an hour ago, an hour plus a few minutes ago, just in remembrance of a healthcare worker who died in Ontario. So I just wanted to remind people to be mindful of that, and I know that Linda and others stand in solidarity with us in this response, and as we move forward through, I think, what Michael Villeneuve called as a marathon. So I just wanted to acknowledge that. Thanks, Tim. So while protecting nurses, physical safety and well-being during this pandemic, it has been and is a primary concern for CNA. We are also concerned about the emotional impact of the pandemic. Nurses are facing unprecedented challenges to their mental and psychological health. And as the national voice of Canadian nursing and nurses, CNA has been advocating for rapid access to no-cost, accessible mental health support services for nurses and healthcare providers, both now as well as into the future. We were heartened to see this week the federal government has been listening, and that the Minister of Health, the Honorable Patty Hadju, launched a new portal dedicated to mental wellness called Wellness Together. And it will connect Canadians. It's intended for Canadians, so it is a resource that nurses can point their families, their friends, their colleagues to, and also to access themselves, to peer support workers, to social workers, to psychologists and other professionals for confidential chat sessions or phone calls, And it certainly will make it easier to find credible information and help to address those mental health concerns. And while that's a step in the right direction, CNA is continuing to advocate for resources and supports that are tailored specifically for nurses and for other healthcare providers. In addition to advocating the governments, we're also working with our jurisdictional partners, and you can visit those websites of, for example, the Association of Regulated Nurses in Manitoba, the Canadian Association of Registered the College and Association of Registered Nurses in Alberta, and other jurisdictions where you'll see links, and they'll start to come more and more to resources and support services specifically for nurses. We've also created a one-page document of strategies, and Elizabeth, you could put that up now if you'd like, on how to cope with stress and to stay healthy during the pandemic. That one pager is being shared in the chat box, and it's also shown on your screen. And it's available on our website, on the Canadian Nurses Association website, on our coronavirus web page. So it's on the website, and then you go to the specific web page, and you'll find this as well as many other resources and many other links to resources. As I said earlier, this is our third conversation, and the first two conversations, recordings of those, are also available on that web page. Okay. So I'd like to turn the conversation now over to our experts, and we have a question for each of them, and I'm going to start with Florence. So Florence, we know that this novel, or this virus, I'm sorry, this coronavirus is novel. It's really still being characterized, so it's actually quite uncharacterized at this point in time, how it acts, who it affects, those kinds of things. And really, we're only close to 4 months into its appearance. So in my mind, and in the minds of many, that gives rise to an awful lot of uncertainty. So Florence, can you speak to how this sense of uncertainty during the pandemic affects nurses' mental health? And how can nurses leverage their knowledge, their skill, their caring in that type of an uncertain situation? So over to you, Florence.
Hi, everyone, and thank you to the Canadian Nurses Association for giving me the opportunity to be part of this panel today and to talk about something that is a passion for me, which is mental health and mental health of nurses. Also, I want to say thank you to all the nurses out there for all the work that you are doing. I guess what I first want to say is that from a personal perspective, my mental health has been affected by the uncertainty of the coronavirus and what's happening today. And that, like many nurses, I've experienced anxiety and stress and fear. Fear of what the future will hold, fear of where I'm going to be. So I thought I'd just sort of start with me. I'm a nursing instructor. That's what I normally would do, but these times aren't normal. So I am now redeployed, and actually I'm in my third area of redeployment, and I've been very lucky. In the areas that I've gone to, I've been redeployed to our 811 information line. I did get redeployed to fit testing. And now I'm currently redeployed with clinical education and long-term care. And I have to say that I'm grateful for the support all these areas have given me and how welcoming they have been. But it's still fearful. It's still uncertain. And I know that many of my colleagues are facing the same sorts of fears. And I know a lot of our nursing students are facing them. I know a lot of our new grads are going to face them, because I don't think that nursing and our healthcare system will look the same when this is over. But what I decided to do on a personal note was I had to find a way to address those fears. And I'm hoping that by doing that, you know, and talking about it today and being honest, that other people will be honest as well. Because I think we need to communicate about our fears and state that we're having them, and recognize that we're not alone in this, that we are all in this together. But through communication, we can find a way to go beyond our fears. And one of the things I just sort of found this morning when I was trying to add something was a quote I found that said, "Courage is not the absence of fear or despair. It is the capacity to continue on despite them, no matter how great or overwhelming they become." And that's where being a nurse comes into it. Nurses have the knowledge and the skills. Nurses are leaders. We are aware of best practice, and we're aware of the research that's out there. And a lot of that will help us with our fears, because we're going to look for the best information and the best practices that are possible. Nurses have skills. We lead, we recognize the individuality of people. We recognize the holism of people, which is where it's so important for us to be treating hand washing and mental health in the same way, that they're both extremely important in this time. We are aware of the differences in people, and that everyone, including other nurses, are going to experience this, what's happening now, this experience in the same way. So I think one of the greatest gifts we have is communication and the ability to be present and actively listen. And I often tell nursing students that you need to understand this person's story, where they're coming from, because that's what makes them who they are, that they're all individuals with different lives and different experiences, and that we need to be present and listen. And I think as nurses, we need to do that for each other as well. And I think the other thing that we have a great leverage in is caring and compassion. I truly believe those are probably two of the greatest things that I've been given as a nurse, is the ability to care and the ability to be compassionate. And I know we're all struggling, whatever area of nursing that we're in, or whatever leadership position we're in right now, with the unknown and the uncertainty. But we need to be compassionate with each other, and to recognize that sometimes people are going to be angry and upset, but sort of to stand back from that. And I think that if we truly show each other caring and compassion, I think then we will be able to come out more resilient and more effective in what we do. And recognize that this is not a sprint, it is a marathon, and that we need to make sure that we're looking after the mental health of nurses now. I think about it in the terms of health promotion and mental health promotion, is that we need to prevent to our best abilities what we may see as a mental health pandemic in our country, and even in nursing when this is done. So I guess the last thing I just sort of want to say to you in terms of my own personal experience is that I've tried to turn what's been happening to me into a positive. And I've recognized that because of my redeployment, I've been an opportunity to use some skills I haven't used in a while, but I've also gained a lot of new skills, and I've learned a lot from the people I've had interactions with out in all the different areas. And that if you want to truly make other people happy, we need to practice compassion. And if you truly want to be happy, then you need to be compassionate. So that's just something that I wanted to leave with you. There's a lot of different resources out there. We posted some of the Canadian Federation of Mental Health Nurses, and Impact Public Affairs with our Canadian Alliance for Mental Illness and Mental Health has developed a document with all the different provincial supports right across the country. And we can share that with you, and it's also found on our website at CAMIMH. All right. So I guess I'm going to pass it over now back to Claire.
Yes, thank you. Thanks so much, Florence. And I know you've been in a number of different settings. I think when we talked, it was, I don't know, 4 or 5. And I just, I'm honored that you're here with us today. And I can just only imagine what a rich resource you would be bringing to those many different settings. So thank you so much for being you, Florence, and for speaking in that honest way. Janine from Saskatchewan, and I thought that was interesting, typed into the chat box that she was having trouble finding her sea legs in Saskatchewan. So there you are out there in St. John's, Newfoundland, really helping us, I think, to find those sea legs. And I must say that myself, especially last week, I really had some very strong emotional reactions to and responses to what was going on. And somebody's put in here that self-compassion, I think, is key. So being compassionate and caring with ourselves first. And fear, one of our board members, Aline Laflamme, who's an elder in British Columbia, said to us as a board of directors of the Canadian Nurses Association that fear is a reasonable response to this situation. It is reasonable. And so to be okay with that, but also to work on sort of tapping into our own resilience, and we're going to get there with our other experts and our other speakers. But you've given us some great things to think about. Thanks, Florence. Okay, Candace, you have a lot of experience in the area of trauma. So what are some things from your perspective over those years, and from your perspective as a registered psychiatric nurse, what are some things from your perspective that nurses can do to protect their mental health? Candace.
Yeah, great. Thank you so much, Claire, and thank you to the whole CNA to including me in this conversation. As a registered psychiatric nurse, I feel quite privileged to be sitting around this circle and speaking on behalf of myself and on my profession as well. So this is fantastic. Thank you so much. I think one of the first things that I'd like to talk about is just, as Florence has mentioned, and as you as well have mentioned, Claire, is that we are in an unprecedented time. We are having these emotions that are swirling around us, that are just emotions that we've never had to this extent in our own workplaces. So the fear, the apprehension, the uncertainty, the grief, all of these emotions are very, very big and very real right now. And I think that they're projecting a lot more than they normally would in a circumstance such as this. So I think one of the first things that we have to do is consider that this is completely normal in this situation. As your board member said, it's normal to have all of these emotions. It's normal to have all of these feelings swirling around us in such an abnormal situation. So recognizing that and honoring that those emotions are quite real and that they do need to be dealt with in a really big way is the first step to try to protect your mental health. So by doing this, as Florence said, I know one of the main things is this compassion and this idea of compassion, and we can support one another in a very real way by being an empathetic ear to our colleagues, by listening without judgment when someone's talking about having a bad day, by doing that in a way that provides that way of opening those lines of communication so that mental health becomes just as important, as Florence said, as the protective equipment that we're using and as washing our hands. The other thing is, in this time, we really have to take the time to show self-compassion for ourselves. We need to be able to recognize that this isn't easy and that this is quite difficult, and we need to be able to make space for ourselves within self-care initiatives. I know one thing I always talk about my students with is you have to find something that will fill you up, something that will make you feel full. Earlier in the week, when we were on another teleconference, one of the members of the CNA said that she had heard, Carrie had mentioned that she had heard that this self-care initiative isn't something that you do for maintenance. It's something that you do above and beyond maintenance. And I think that that's something really important to consider. Self-care isn't a privilege right now. Self-care isn't an indulgence right now. Self-care is a necessity. So making sure that you find that time for you, that time to fill yourself up is so important right now. And that might mean you need to talk to your support groups or talk to your colleagues or talk to other people around you to emphasize how important that self-care time is. We're often so busy with so many other things that are going on in our lives that it can sometimes feel a little self-indulgent to take that bath that you find so fulfilling, or to watch that show on TV that you find is just mindless that will help you to cope with life. But right now, at this point in time, we have to consider those things to be necessities, and we have to allow ourselves the space to do that without fear and without grief and without guilt, which is a big thing as well. Another thing is to reach out to supports. And I know the polling question that I was really curious about today, and others were too, is how much nurses have been using employee assistance plans in the past and how much they think they're going to need in the future. Because that is something that will be very needed, I think, moving forward with through this pandemic, and also trying to cope with the pandemic as it starts to wean off in the end, because those feelings of grief and all those other complicated feelings that we're having are not just going to go away after this is done. There will be a lasting impact. So reaching out and talking to people within those formal services that are offered through our employee assistance plans, and doing it without stigma and doing it without shame, because this is something that we naturally need to do in order to protect ourselves. Another thing is different apps. So I know I personally use Calm. It looks like there's some other information sources that are coming up on the side about what other people use in other circumstances. There's also mindfulness app, Headspace. Those are two that are quite common. You can find a lot of different resources like that online that you can use to help to protect yourself. I know when I'm having a time where I'm not sleeping very well, I really rely on the Calm app, because Matthew McConaughey can lull me off to sleep, which I find quite relaxing and quite comforting. He has a very lovely melodic voice. So, but it's trying to find those things that will work for you. And that's the most important piece, is trying to find something that will work for you to help to reduce those anxieties and those fears and those apprehensions, and then starting to make that part of your normal everyday routine. Thank you.
Thanks so much, Candace. That was excellent. And I'm going to encourage people, you're already doing it, but into that chat box, if you would feel comfortable typing in or sharing with us either resources or tips. There's one there about journaling. And this one nurse, as you can see there, started a journal during SARS and found it an interesting read now, and has has started one with COVID-19. So I think those are really some really good ideas here, and very helpful. One of the words that you used a number of times, Candace, and I think it's a really important word and a really important concept, and that is about protecting. And so when you say protect our mental health, it implies to me that we have that resource, that it is there, right? That's hopeful. And that we have a responsibility, in essence, to protect that resource. And we protect ourselves by washing our hands, as Florence, wearing a mask, doing those kinds of other protective things. But I think the notion of protecting our mental health is a really important concept that actually frees me up a little bit to think about those self-care and that self-compassion that we've talked about. So Louise, we know that nurses are resilient, human beings are actually resilient. But at this time, that resilience is really being tested, I think, and will into the future, into that long run in front of us. So what are some things from your perspective, Louise, that we can do to build on that resilience? And what is your advice to leaders, to those that are sort of in those more formal leadership positions? And are there a couple of tools or resources from your perspective that you might recommend for those in the audience and for nurses to use? So over to you, Louise. I think you have to unmute.
Okay, that helps, doesn't it? Thank you so much, and I'd like to also add my thanks to everybody who is working the front line today, tomorrow, yesterday. It's an amazing thing to do. I've spent most of my career in mental health, although I had a couple of years in a large tertiary care hospital out west, and I used to be absolutely in awe of all of the things that nurses did in a variety of settings. And so my utmost respect. The one thing I did notice when I was in that role and was seen as a nurse with a mental health background is that nurses are very resilient, but there's also a belief that you need to be always tough, and that you can get through this, and you know, people go to you for help. You don't go to others for help. And so I know that that's a common way of looking at things. And like my two colleagues before me just said, you know, this is not the time to be a hero all of the time. You are doing that every day that you are on the front line. You are absolutely doing that. And so I think it's really important that, again, to stress that it is oftentimes a normal reaction to an abnormal situation. And that, you know, while it is normal, if you don't keep a check on it and try to figure out where you are on a continuum, and we are all on a health illness continuum, that you probably won't go to get the help that you need and could prevent a longer term situation from escalating. So I think that that's really important. Some of the things that we all should be doing is we're talking about physical distancing, but it is so important to remember that there needs to be strong social connections, and recognizing that not everybody responds to every situation in the same way. We all respond differently. And you know, we talked a little bit in preparation for this session today about potentially having a buddy system. And I don't think that that needs to be necessarily formalized. We can do that ourselves. It's really important to be able to reach out and talk to someone when we need to do that. A couple of tools that can be utilized, and I believe they have been made available here, is the Mental Health Commission of Canada has developed a crisis response program that is going to be in about 10 days time launched, that people will be able to take. And so there are two components. One is to identify problems in others, and the other one is a self-assessment tool. And the two posters that is made available to you today, I would encourage you to print them, put them up in your place of work for many to see. One is called How Am I Doing? And as I mentioned, it's on a continuum from green to red. And we all go back and forth somewhere on that continuum every day. And it's not pathologizing this in any way at all. It is response to a very horrific situation. So when you look at that poster, and you can click on the little icon there to get additional information, but it's a check-in with yourself. I think it's something we should be doing at the best of times, let alone at a time like this. And I think that that can be really helpful. You mentioned, Claire, at the outset, the launch this week of Wellness Together. And I think that that is another tool where e-mental health apps are being utilized. These are apps that have been evaluated and have been utilized effectively, because in the time since we began this panel today, there's probably been 50 more apps downloaded. We don't know if they help. In fact, many of them may even do harm. So it's really important to seek out credible resources. The Wellness Together does that, and it has a stepped care approach where you can look at which step you're on and what kind of care that you need, and then access e-mental health that you can utilize when you need some additional help. So I think that's really important. Again, we're utilizing technology, the very thing that probably 3 months ago I would have said, oh yes, technology keeps us from interacting with each other. And then here I am. So, but I do think we need to use technology to keep connected, but we need to unconnect at times as well. And listening to news and reports of what's going on, I really would strongly encourage people to try to limit the amount of exposure, because it can increase stress load. Leadership is so important, and nurses are the quintessential leaders in every situation. And some of you have more formal leadership roles. The second poster I'm going to talk about is one that's called "How Can I Help My Team?" And it talks about everything from acknowledging and active listening right up to responding and follow-up. And so there are ways of dealing with that. I personally think that right now, the strongest kind of leadership that can be demonstrated is showing one's own vulnerability. And that's not easy to do. As nurses, we haven't been trained, we haven't cultivated that. But there is something, and I have experienced it time and again, there's something very powerful about expressing your own fears, your own concerns, and talking about how you have dealt with them. On Twitter this morning, I watched that piece by Brian Palliser, which was absolutely heartwarming and so powerful. And so here was, you know, a well-renowned, respected political leader sharing his own vulnerability in terms of his own emotions. And I thought it was one of the most powerful pieces I have seen in a long time. I'd encourage you to have a look at it, because it takes a pretty strong person to be able to acknowledge that. The other thing I would encourage you to do is the Mental Health Commission of Canada has developed a hub, which is kind of a one-stop shop that points you to good, valid information and where to get help and how to seek out the best kind of information that you need right now. So please visit our website and check that out as well. So right now, I think that looking after yourselves is not a nice to do. It's absolutely essential. And it shows strength of character. And I'd strongly encourage everybody to also have a look at some of the psychological safety factors for the workplace. It applies now every bit as much as it did 3 months ago. Psychological support are some of those factors, clear leadership and expectations, and civility and respect. So I will stop there to allow some time for questions and discussion. And again, my sincere thanks to everybody and all that you do, and be well and stay safe.
Thank you, Louise, and thank you also to your organization for being there and for responding so well. So thank you, and there's lots being posted into our chat box. So I did ask each of the presenters or the experts, because you are such experts, to prepare to give a couple of pieces of advice, but I'm going to just turn it over to Carrie for a moment. Is there one question? We have about 6 or 7 minutes here where we could ask our experts for their advice, but also what's that one question that we've been hearing there, Carrie, as we've watched both the Q&A and the chat box? Carrie?
Thanks, Claire. So there's a lot of great questions. Thanks everyone for the questions coming in. As Claire had mentioned, our team, if your question isn't answered, will collate and find a way to respond. But the questions I'm seeing most about are just tips on how to manage feelings, your own feelings as a care provider, or feelings, support colleagues, feelings around compassion fatigue, and then also feelings about guilt for nurses who may not be working at the point of care or who have colleagues who are in a more vulnerable position, and how to manage that.
Thank you, Carrie. And just right there, there's one from a nursing student about their future clinical placement. So there's like, what I hear is just this multitude of stressors and things coming at those that are in this conversation with us. So I think I'll just go back to each one of you, and I'm going to start with you, Candace. Is there some just very concrete pieces of advice? You've given us lots of resources, pieces of advice or tips in terms of that compassion fatigue, the worry about our family members, the worry about all of those other things that are playing on us. So Candace, maybe to you first, and then I'll go to Louise, and I think I'll finish with you, Florence.
Okay,
Candace?
well, first, yeah, thanks, Claire. I'd like to say first that, you know, a lot of you nurses that are already expressing those fears and that feeling of guilt and all of those feelings that you're having a hard time with, you're already taking the first steps. You've already started to really think about those emotions and how they're affecting you, and you've already started the dialogue. So that is definitely the first step to trying to start to alleviate some of those. Deep breathing can always help when we're feeling those feelings start to get overwhelming. And I'm sure that I haven't had a chance to look at the new app that Louise was talking about, but I'm sure that there's resources on that can help to teach deep breathing exercises to help people to just get those overwhelming emotions under control, and to know that everybody plays a specific role within this, and not all of us are able to be on the front line. But we can still consider compassionately those that are, and we can do everything we can to try to support them through this in a way that provides them with even just that verbal support to help people on the front line to get through it. So those would be two things that I kind of suggest, is if you are kind of on the back, know that you're there for a reason and you're doing a job that's needed. And if you are on the front line, use those other resources that you have to try to help you through it.
Thanks so much, Candace. Those are great tips. And Louise talked about buddy, right? So even finding a buddy where you could be that buddy and that safe place to just share those emotions would be something that those of us, and I'm going to put myself in that place, not actually right at that point of care, and providing support in a different way. So Louise, you gave lots of advice and tips, but do you have a couple more just as we're closing out? So Louise?
Thank you. I'd like to address the issue of guilt. And I want to do that because it's something that I struggle with for sure. I'm on a board of a homeless shelter, and I've been spending quite a bit of time with them over the last few days. And then as I sit here all by myself for the last 5 weeks, feeling sorry for myself, I think, oh, Louise, you shouldn't do that, because there are so many people that have it so much worse. And I think that it's important that we all identify the losses that we have had. They don't, and it's not a competition. Somebody else's situation may well be worse off than you are, but this isn't the time for that, for sure. So it's not a competition. And I think this is a time when we all want to have control over our situations, yet we have lost so much control over everything. And so please, I would really strongly, I don't think that denying our losses and saying others that have it worse off is being altruistic at all. I think, in fact, it might even harden us to the plight of others if we're consistently trying to deny our own losses and our own grief in this situation. So I hope I understand it well, and I hope you'll join me in being a little more self-compassionate. Thank you so much.
Thank you, Louise. That's very wise advice. Thank you so much for that. And I'm going to commit to try to practice that. So thank you for the reminder myself. Florence, final word to you. Do you have a couple of tips or pieces of advice for us and for the audience?
I think it's a lot of what everyone else has said, but I think we need to be kind to ourselves and recognize that we're all experiencing fear and that we're all feeling guilt, and, you know, understanding that things may not look the same when we're finished this, but in fact, we may get great strengths out of this, great personal strengths, great growths, new relationships. So trying to somewhat stay and take some of the positive for it without not saying that you're not fearful. So how can we best turn it around? And I really like the idea of a buddy. I'm a full supporter of peer-to-peer, and I know here in Newfoundland and Eastern Health where I work, they have a peer support program. We have a virtual app, but reach out to your co-workers, reach out to your friends, your family, and, you know, be good to yourselves. I think the greatest advice I can give, and, you know, making sure that we're taking care of ourselves, and then we can take better care of each other. I guess the one thing I saw today that was really struck with me was I saw something on social media, and it said, today I will be kinder, today I will be stronger, today I will grow. And I think that made me sort of think how I could turn things around so that I could try and take some positive out of what was happening.
Thank you. Thanks, Florence. And I just want to wrap up. We're at our 45 minutes. It always tends to go really, really fast. I just really want to give our sincere thanks to our three experts. You are truly experts. You are wise women. And thank you for taking our invitation and that sort of risk and stepping into this space with us and talking about what really is a very important but also can be a very difficult topic and a very difficult place. I want to thank the staff at the Canadian Nurses Association for their great support in hosting these conversations. We'll see you again next week on Friday. We'll send out a notice to that. And just stay tuned next week, and we'll be joined by somebody from the Public Health Agency of Canada. So we're going to hear from that organization and that perspective. Okay, so have a good week, everybody. Be kind to yourself, and we'll see you again next week. Bye now.
Bye.